99.9 KTDY, the best variety of the 80s, 90s, and today an Uncle Cracker at 8:07. Can we talk about what y'all were talking about off the air? I just heard it out the corner of my ear.
Yeah, sure. There was a story in the news this morning about young women and what happens to their bodies, and it basically was verifying once again something that Dr. Kevin has been talking about forever. Yet somehow the people that did this research are the experts.
Yeah.
You know,
Harvard said
Really?
it, so they're the smart ones.
Really?
Something I've been saying for a long time.
Is it something we can talk about on the radio?
Well, it's just, it's no problem. It's just they're finding that girls are reaching puberty much quicker than they used to.
Mm-hmm.
Well, yeah, you've been saying that
exactly
forever.
But it's news because Harvard did some research.
Well, what's the reason? Is it because what they're putting in their bodies?
It is. Yeah.
Well, there you go. Boy, that was scientific.
Done and done.
Right.
All right, Dr. Kevin's here with the Bryant Wellness Institutes of Acadiana, and it's Wellness Wednesday.
Yeah, last June I had announced that I had been doing a new procedure called integrative dry needling, and I don't know if y'all remember that show or not.
I do, yeah.
I've had several.
We got a lot of calls about that show.
Yeah, and I've had several people ask me in the meantime, because sometimes when you first start doing something, people want to wait and see how it goes before they actually start. And so now that I've been doing it for a while, I've had several people ask me, how's that going? Is that been effective? And so I wanted to give everybody a kind of a report and kind of revisit this issue today. And I can say to our listeners that this procedure has been absolutely a remarkable tool in the treatment of chronic pain, things like muscle damage, like tears, frozen shoulders, rotator cuff problems, plantar fasciitis, carpal tunnel, you name it. Chronic pain, this has been quite a remarkable tool for the treatment of almost any type of chronic pain in the body. And we have so many listeners that are suffering with pain, and they just sort of deal with it. They haven't really found a good solution to it. But if you've had pain more than once or twice a week, or you've had that pain more than a week or two, that is of concern. That is something that you should really take a closer look at, because there's a reason that that's happening in your body, and it's not because you have a shortage of Advil and you have to add it every day to your body in order to be healthy. There's something else.
And this is not acupuncture, right?
No, not at all.
Okay.
And so you're kind of saying that you can if folks are experiencing pain, and maybe these people have even been told that they need surgeries or whatever, or maybe they've had surgeries and they still have the pain. Yeah, this can help them.
This is where this dry needling procedure shines. Exactly right. People that have had reoccurring pain, they can't figure out what to do with it. They've been everywhere else. They've maybe even had failed surgery, and they're still having pain in their body. Now, the way that dry needling works is a system of treatment for all different types of pain. And so many times people will ask me, how can it help shoulder problems, back problems, knee problems, ankle problems? How can it help so many different conditions all at once? It doesn't make sense. Well, when an area of the body becomes painful, what happens, the body's response to that pain is to contract the tissues around that pain. This is called splinting. Now, splinting is the same reason why if you've ever hit your elbow, you grab it and hold it close to your body. That's your body doing splinting. And that's just a reflex that your body goes through whenever you're in pain.
My entire body does that when I stand next to JC.
Your whole body is splinting.
My whole body does that at one moment when JC walks into the room.
I'm with you. Now that's called splinting. Now, the bad part about that, and that's to protect our body. That's the reason your body does it. So when your body does that, it's protecting itself. There you go. Right?
Told you.
Now, the problem with this contraction is when painful tissue contracts, what happens if it contracts enough, it pushes the proper blood supply out of the area. In other words, it contracts and cuts off almost the circulation in that area. Not completely, but some. And that robs the area of the proper blood supply to that painful tissue. Now, the problem is the blood is what carries everything that tissue needs to heal. So it carries all the oxygen, all the healing chemicals, all the pain.
Well, Doc, it almost sounds like a malfunction in the body.
And anti-inflammatory. Well, it doesn't happen always when we have pain. I mean, when you cut your skin, it heals. But when an area becomes chronic, the question that I always ask patients is, why hasn't it healed? Why when you cut your skin does it heal? But this chronic area you've had for years, why hasn't it healed? And this is why.
Wow.
When the tissue contracts and it pushes the blood's flow out, it can't get the oxygen and healing chemicals that it needs in that area. So that in turn makes it more painful, which makes it contract worse, which pushes more blood supply out, making it hurt worse.
So instead of getting better, it gets worse.
It creates this process of spiraling downward until the tissue becomes chronically painful and sick, and it just will not heal. So this explains why chronic tissue doesn't heal and acute injuries do. If I sprain my ankle, it heals itself in a few weeks. But why does this chronic sort of low back or this chronic knee or this chronic shoulder problem, why doesn't it heal? And many times this is the reason, is this splinting, cutting off circulation, and it's creating this downward spiral. So this is the main reason why chronic painful tissue never heals and a sprained ankle or a cut on your skin does heal. So this describes what happens when patients have had that, that lower neck, or they've not lost normal range of motion in their shoulder joint, causing frozen shoulder, or why an old knee injury won't heal, or a chronic low back will just not get better. Things like tennis elbow, carpal tunnel, and headaches. This can all be caused by this chronic tissue response where the tissue gets contracted, it gets painful, pushes the blood out, the body can't get what it needs there to feel better, so it gets worse and worse, and it downward spirals.
It almost sounds like it has kind of the same effect on your body as a good massage does, only much more so.
Exactly. It's almost in the reverse of that. Yeah,
Gotcha.
Exactly right. Now, this cascading effect of pain and the loss of the body's ability to send all of the healing mechanisms to make that tissue healthy again, this is something we call chronically sick tissue. And that's what differentiates your chronic problem from a new problem, or something that just happened, or something that can sort of get over itself. So when we get back from break, I want to take some time to explain how this integrative dry needling process reverses this chronic spiraling process that we just talked about. Like, how does this treatment or this procedure, how does it overcome this downward spiraling of events that I just explained takes place in your body? And how do we get this process to, how do we stop the cycle? How do we break the cycle of this downward spiral of pain, contraction, loss of blood, worse pain, worse contraction, worse loss of blood?
To hear
Okay, can't wait.
Yeah.